Remember back in 2014, you couldn't scroll through social media without seeing a video of someone dumping ice-cold water over their head. These videos were part of a campaign to raise awareness for amyotrophic lateral sclerosis. ALS is a progressive neurological disease of the motor neurons. Motor neurons are nerve cells that extend from the M1 region of the brain to the brainstem, spinal cord, and finally to the muscles throughout the body in order to control voluntary movements. The upper motor neurons transmit signals to lower motor neurons, which then synapse onto a muscle in order to initiate a contraction. With ALS, both the upper and lower motor neurons of the corticospinal tract degenerate due to a lack of proliferation of neuron cells. Motor neuron degeneration leads to thinning and scarring of the corticospinal tract in the spinal cord. Damage of the corticospinal tract inhibits lower motor neurons from synapsing onto the muscle. Unable to function properly, the muscles gradually weaken, start to twitch, and atrophy. Eventually, the brain loses its ability to initiate and control voluntary movements. Denervational atrophy of the muscles of the tongue, oropharynx, and limbs, as well as the thinning of the ventral roots, is due to the brainstem and spinal motor neurons beginning to degenerate. Until further prognosis, there are no degenerative changes affecting the neurons that innervate the muscles of the eye and the bladder. Initial symptoms of ALS include lack of coordination, dropping things, tripping, muscle weakness, and slurred speech. As the disease progresses, patients have difficulty with autonomic functions such as breathing and swallowing, and voluntary functions like walking and talking. Those who are most likely to develop ALS include men, older adults between the ages of 55 and 75, and Caucasian individuals. Unfortunately, there's no one test that can diagnose ALS. A combination of EMG to measure the amount of muscle activity, nerve conduction studies to assess the nerve's ability to transmit a signal, MRI to rule out other neurological disorders, and patient symptoms and observation can collectively diagnose ALS patients. Medications such as riluzole and Edaravone have been approved to treat ALS. Riluzole is believed to reduce damage to motor neurons by decreasing levels of the excitatory neurotransmitter glutamate. Riluzole has only been shown to prolong survival by a couple months. Edaravone has been shown to slow the decline in clinical assessment of daily functioning in persons with ALS. Physical therapy, speech therapy, and breathing support can all be used to aid prolonged quality of life and the ability to function. 1 in 50,000 Canadians are diagnosed each year. Around 1,000 Canadians die each year from ALS. Between 2,500 and 3,000 Canadians are currently living with ALS. 80% of people die from ALS within 2 to 5 years. Only 10% of people diagnosed with ALS live 5 years past their diagnosis. One notable example is Stephen Hawking, who lived with ALS for over 50 years. A possible explanation for him outliving his prognosis can be attributed to the fact that he was diagnosed with juvenile onset ALS, which progresses much slower than adult onset.